How does bladder anatomy control incontinence? The urinary bladder is a fascinating organ, and its anatomy plays a crucial role in controlling incontinence. Understanding how this works can help us appreciate bladder health. The bladder is primarily controlled by the detrusor muscle, the urethral sphincters, supportive pelvic structures, and the nervous system. Together, these components work to store urine and prevent involuntary leakage while allowing for voluntary emptying when we choose. First, let's talk about the detrusor muscle. This smooth muscle forms the bladder wall. When the bladder fills with urine, the detrusor muscle stays relaxed. This relaxation allows the bladder to expand without increasing pressure. When it's time to urinate, the detrusor muscle contracts, pushing urine out of the bladder. Next, we have the urethral sphincters. There are two types of sphincters that control urine flow. The internal urethral sphincter is made of smooth muscle and provides involuntary control. The external urethral sphincter is made of striated muscle, allowing us to control urination voluntarily. These sphincters stay contracted while the bladder fills, keeping urine from leaking out. When we decide to urinate, they relax, allowing urine to flow. Supportive pelvic structures also play a key role. Ligaments and muscles in the pelvic floor help stabilize the bladder and urethra. Important ligaments, like the pubourethral ligaments, support the urethra and bladder neck. If these structures weaken due to factors like childbirth or aging, it can lead to stress urinary incontinence. This means that when there is increased pressure in the abdomen, such as during coughing or sneezing, urine may leak out. The nervous system is essential for maintaining continence as well. It involves complex regulation from both the central and peripheral nervous systems. Sensory nerves detect when the bladder is filling and send signals to the brain. This communication helps coordinate when to relax the sphincters and contract the detrusor muscle. There are two types of bladder nerves that play a role in this process. A delta fibers detect bladder fullness, while C fibers respond to irritation or pain. Lastly, pelvic floor muscles contribute to continence by supporting the bladder and urethra. When these muscles contract, they increase the pressure around the urethra, helping to prevent leakage, especially during physical activities. In summary, urinary continence relies on the coordinated actions of the detrusor muscle, sphincters, pelvic support structures, and the nervous system. If any of these components are disrupted, it can lead to various types of urinary incontinence, such as stress or urge incontinence. For those dealing with bladder conditions or bladder cancer, understanding this anatomy is vital for managing symptoms and maintaining a good quality of life. Always consult with healthcare professionals for personalized advice and treatment options.